Thank you. And it's my sincere pleasure to welcome you all to CC's poster session. And many of you may not know that April is Interprofessional Healthcare Month. And so we're absolutely delighted to be honoring it with such impressive student presentations that I know you are really going to enjoy. Today, you'll see a collection of work done by students throughout UNE's graduate and undergraduate programs, some in collaboration with Rosalind Franklin University, and I believe we have a couple in collaboration with Tufts University. We're delighted to have so many undergraduate submissions this year, and we're looking forward to more in the future. Though it may seem to many of you that it's seamless to do collaborative learning activities and to successfully design and implement them, that is an illusion. But this is a great time of year to thank a lot of people who have made this possible. So first, I want to recognize the generosity of all the faculty, staff, and advanced students who have really helped us this year, our graduate student leaders and the professional staff. And in particular, I want to give a shout out to Dave DeDiego and Lee Cody, who absolutely make this possible. To Megan Rogers and Elise Parker and Julie Shea, you have been amazing. To Kira Rodriguez, what would we do without you to make sure we're doing stuff that makes sense and that makes a difference? To Sarah Garber, from our good friend from Rosalind Franklin, Colin Bader, Tom Muser, and of course, the incomparable Michelle Cody and Chris Hall, without whom we would not be able to do this at all. Another individual for whom we will be forever grateful and who I will now introduce is Associate Provost Mike Sheldon, who will have a few remarks. Welcome, Mike.
Thank you, Shelley, and good afternoon, everyone. It's an honor and privilege to add my welcome to the Center of Excellence in Collaborative Education's Spring Student Poster Session. Today's poster session is a shining exemplar of what the Center's purpose is all about. 108 undergraduate and graduate students representing 15 health professions, bringing their interprofessional learning and practice experiences to life. A time when we all come together to learn from, with, and about the amazing work UNE students are doing to improve healthcare practice and health outcomes. Today's program looks outstanding, so congratulations to all of you. UNE truly is a national leader in collaborative education. Some of you have heard me say this before, but it is worth restating. Barbara Brandt, the director of the National Center for Interprofessional Practice and Education, referred to your collective work at UNE as, quote, cutting edge leadership in the field of interprofessional practice and education at last year's Nexus Summit, where UNE once again had a strong presence with numerous student and faculty presentations. Faculty and administrators from other colleges and universities from across the country come to UNE to learn how we do what we do, and often comment that they struggle to achieve the same outcomes we do because of entrenched disciplinary silos at their institutions. At UNE, collaboration is just a part of who we are, and we're truly unique in that regard. In addition to the thanks that Dr. Cohen-Conrad extended on all the folks who made today's presentation possible, I'd like to thank her for her leadership of the center. Again, for who this event would not be possible for her not being in that role. So thank Dr. Cohen-Conrad for making this virtual event possible, along with the many other activities the center hosts and conducts throughout the academic year. And now it is my pleasure to turn the virtual floor back to you to present this year's Interprofessional Service Award. Thank you.
Well, thank you, Mike. That was very sweet, and I really appreciate it. So each year, I have the honor of presenting the Lisa Pagnucco Interprofessional Faculty Distinction Award. Dr. Pagnucco was a trailblazer in mentoring cross-professional student groups and was the first to bring the National Clarion Case Competition to UNE. Dr. Pagnucco is no longer at UNE, but her legacy definitely lives on through this award. And I'm probably going to get verklempt. I'm just telling you that ahead of time because I always do. This year, the award goes to trailblazers in the interprofessional research and scholarship arena. Dr. Elizabeth Cramsey from the Department of Occupational Therapy and Kira Rodriguez, IP Evaluator Extraordinaire, whose base camp is the Center for Excellence in Public Health, are receiving our award this year. Together and with interinstitutional colleagues and students, Liz and Kira carried out multiple research projects, each of which was presented at the 2021 Nexus Summit, and one of which was recently submitted for publication, but we have not heard anything yet. So we're fingers crossed on that one. Their work as IP research scholars fulfills CC's promise not only to offer exceptional collaborative learning opportunities, but to evaluate their efficacy and meaningfulness to best practice. I can't thank you enough, the two of you. You are fantastic. And your leadership in this critical arena was incredibly impressive. So please, everybody, join me in congratulating our 2022 IPE Faculty Distinction recipients.
Look at that Zoom magic.
Thank you so much for recognizing the work that really is just an honor to be a part of, watching the students, faculty, and staff come together to gain such incredible skills. CECE does an amazing job, and like I said, it's just truly an honor and a pleasure to work with the students in their process. Kira?
Thank you, guys. I love working with the CC team because you all love what you do, and it's infectious, and it ends up in quality work that is, wonderful to be around. So thank you so much for this honor.
Well,
Again,
congratulations.
one last hand of applause for our recipients this year. And Chris, I pass it to you.
Thank you. Thanks, everyone. Congratulations, Liz and Kira. You really exemplify what is true of everyone in attendance today. Interprofessional education is the work of many hands and many hearts, and we appreciate your time and energy. And now it's my turn to get teary, but thank you. So my task today, I'm going to share my screen so that you can see the layout. My task is to sort of tour you around what's available to the folks on Zoom today. If you're viewing on Facebook or on the live stream, you can just relax and enjoy the show. It will come to you. If you're participating in Zoom, you can see that there are 4 breakout rooms. Relationships and telecollaboration take you through the interprofessional team immersion presentations, which are varied and fantastic. The research track includes an extended discussion of the interprofessional mini-grant funded work being done by students at the Westbrook Housing Authority with Tom Muser. So that will be a great chance to discuss that thoroughly. And finally, in the Students as Teachers track, we're showcasing a variety of teams, including some really excellent leadership from both graduate and undergraduate students. And we're happy to be able to showcase the breadth of what UNE has to offer that way. Each presentation in the event today has an opportunity for Q&A built into it. So I hope you will take an active part and unmute your video and your audio when you're speaking and engage in that conversation with us. Lee, you can go ahead and open up the breakout rooms now, if you would. And everyone should receive an invitation to choose the breakout room that you're most interested in. And go ahead and navigate there. And if you're stuck, stay in the main room and we will help you. If you're on Facebook and live stream, in just a few moments, you'll start out in the relationships track. I can see that people are moving into their breakout.
I'm so glad to see so many people joining us. And Julie, let us know when we're ready to roll.
The aim of the Interprofessional Team Immersion was to provide University of New England students with the opportunity to gain a better understanding of the roles and responsibilities of each healthcare profession and have a chance to practice communication skills in a telehealth setting. The current group included students from occupational therapy, physical therapy, social work, osteopathic medicine, allopathic medicine, dental hygiene, and nursing programs. Our research questions were: how do interprofessional relationships affect teamwork and resilience? And does additional time for social connections have implications on teamwork in the healthcare field?
Group faced many limitations while working together, one of which was difficulty built in trust and rapport with our client through telehealth as it lacks personality. Another one was the lack of time we had for building interprofessional relationships within our team. And we also had decreased exposure to other student health program demands throughout our curriculums. Some of the strengths that our group found were that we took additional time to meet as a group outside of what IPD had provided us with. We had mutual respect and understanding of each other's professional roles, and we all came prepared with our own ideas and plans before meeting to be able to contribute to the group.
It's a unique experience within IPD to receive feedback from the patient actors at the end of both patient encounters. Our team experienced some significant challenges with the way we receive feedback from our patient actors, and this is why we've led to the research question of how do interprofessional relationships affect teamwork. The additional time that we spent really helped buffer our resilience in the way we receive feedback to make sure that we could interpret that in a way that was productive for each other and ourselves as a team and our own future implications as healthcare workers.
We apply this to our future practice. Together, we learned that spending more time communicating and elaborating with our team unit allowed us to gain a more clear understanding of the interventions each profession can provide. Working together to collaborate as a team unit on patient care plans allowed us to help gain an understanding as each other as a resource as well as a referral network.
We want to thank the University of New England and Rosalind Franklin University for coming together to make this immersion possible. Through IPD, students are able to make professional contacts outside of their own health profession. They're able to gain comfort in identifying, acknowledging, and taking steps to prevent and correct medical error. And we're all able to practice our interpersonal and interprofessional communication skills for diverse and difficult healthcare conversations. Really, what this allows us to do too is take all of our awareness for how interprofessional teams come together and practice it on a clinical practice level.
Thank you very much.
Well, thank you. So this is we have a few minutes for Q&A, and I expected Provost Sheldon to raise his hand. Go ahead.
I always ask a question. So this is the entire group. Tell me one thing that you were surprised about learning, something you learned about what another profession does.
I was kind of surprised at how many resources like Sarah knew about. She's in social work, and like I didn't realize how I honestly had not much of an understanding of what a social worker does. And after like doing this group experience, there's so much like it's like turning through my head, and I'm like, okay, if a patient's struggling with this, I can get them in contact with a social worker and she can help them with X, Y, and Z. And like there was like that was a huge bridge that I feel like is going to help me in the future.
Amanda, what profession are you?
I'm in dental hygiene.
Well, fantastic. Great learning. And Sarah, how do you feel about Amanda's learning?
I'm so glad Amanda jumped right off first, because I actually was going to say that I was so impressed that Amanda in dental knew so much about the patient's medications. She had done advanced research to really understand the pharmacological product, and I really would have thought that would have come from pharmacy. We didn't have a pharmacy student on our team, and that was really filled by dental. It really blew my mind how much awareness she was able to have.
Fantastic. Another question. Courtney, did you want to say something?
Sure. I'm from physical therapy, and I thought it was just unique going through the whole process, just learning about how kind of all of our professions interlap with one another, where someone might provide medication and someone might recommend exercise and someone might recommend just social work. So it kind of like was really neat to fill in the gaps for everyone else of where their profession kind of ended and where one started. So that was really unique that we could all kind of work together.
Courtney, I should have shared the majority of my career here has been in the Department of PT. I was a program director for over 20 years.
Nice. Great. Who would like to ask another question or make a comment?
I have a comment. I was looking at the takeaways and I really liked how it said to be intentional with your suggestions, because I feel like through school you just learn so much, and then when you're new in the practice you just want to help, and I feel like a lot of times it might be overwhelming for the patient to like give so many different suggestions even though you have good intentions. So I feel like I really enjoyed that takeaway of just kind of really thinking about like how much information you want to give and how helpful it would be to kind of make that more concise and like more client-centered.
I wanted to comment about team resilience. I think that is a critical takeaway, and I'm so glad you presented on that, because sometimes working with patients is difficult. And especially when dealing with something like long COVID, which we don't really know very much about. I think patients are frustrated and practitioners are frustrated. How did you come up with the idea to focus on team resilience, which I think is very forward thinking?
I can hop in and say that I think we wanted to develop relationships with each other, and telehealth has been really challenging with that. I think that some of us discussed that our expectations we would have time to get to know each other going into this experience. And one of the things we were hopeful for about the IPD experience was that we would have more informal time. And when that wasn't really presented, we created it. We joined a Zoom ahead of time for an hour and called it pre-IPD mingle. Team mingle, so we could just get together and chat about what was going on with our lives and our programs and our learning. We discussed a little bit of the case, but I think those relationships, what we learned was they were really significant. Especially, we got some difficult feedback from our actors, and in a way that really didn't sit well. And because we had invested in building relationships and trust with each other in that informal get to know you time, we were able to reconnect and kind of process that together and do a team processing. And I think that would really help us face adversity, just having relationships with our colleagues interprofessionally.
Thank you for that, Sarah. That was great, because relationships really matter, and the idea of psychological safety and feeling comfortable with one another is critically important in the workspace. And we heard that a lot in our research that we did, is that ability to form relationships and trust one another was critically important. I'll ask one more question. Probably Mike and I can continue asking a lot of questions, but you've mentioned the difficulties of telehealth, and I'm curious if anybody would like to comment on that. The impression I got is that it's a little awkward, it's a little impersonal. But you can say more, and how did you navigate that?
I can jump in on that question. I think one of our conclusions at the end of this project was that next time we would send in an initial patient navigator, likely either the social worker, which would be Sarah, or me as the occupational therapist, just to kind of build that rapport and trust with the client, because it is a little bit more difficult to do over telehealth. So that's one of our biggest takeaways for the future.
Great, thank you. Other comments?
Just to clarify, Megan, are you suggesting like a hybrid model where there'd be some initial contact, but there could be follow-up sort of via the telehealth option?
Yeah, that, and also just always having that navigator in the room, either over Zoom, or I guess it could be with the client as well when they're interacting with other healthcare professionals. So they already have that trusting relationship with one person.
To build off what Megan said, our patient expressed that she was overwhelmed when we had new health professionals enter the room. She didn't see a familiar face from the first session, and she did express to us that she was like overwhelmed. She was like, who are all these new people? So that's why we thought it would be helpful to keep one person there constantly with other people rotating in and out.
Thank you so much to this group, and I just wanted to keep everyone on track in terms of timing, so I'm just going to be sharing the next screen.
Interdisciplinary team telehealth visit may be even more challenging. Our team reviewed the experience of working with a simulated long-haul COVID patient to create an easy template of do's and don'ts to promote a successful interprofessional telehealth visit.
To introduce ourselves, the members of our interdisciplinary team include Hannah Freeman, student registered nurse, Sarah Haas, student of physical therapy, Keely Hart, student registered dental hygienist, Meredith McHugh, osteopathic medical student, Tally Toomey, occupational therapy student, and we are all students at the University of New England. And lastly, we have George DeRouge, medical student at the Chicago Medical School.
We also wanted to acknowledge that this project was an interprofessional team immersion project, and we also wanted to acknowledge Dr. Rachel Mayer, who was advising us throughout this project, and to Amanda and Mo, who were the community actors who facilitated our learning experience and gave us valuable feedback, and to all of the staff at the Center of Excellence and Collaboration Education at the University of New England, as well as the faculty at Rosalind Franklin University for making this experience possible.
We all worked together as an interprofessional team for this case study pertaining to long COVID through telehealth. Through this process, we reflected on our teamwork and how we could improve to make a better experience for the patient. We met in total 4 times over telehealth. We received feedback based on these sessions in order to develop an easy list of do's and don'ts as a template for future teams to have a more efficient and productive experience.
Our guide is as follows. Use a questionnaire before meeting the patient to gather information. Do ensure privacy. Do know your team and introduce them. You should actively listen. Do make actionable goals that are patient-centered. And also do be flexible. Don't make assumptions. Don't forget bedside manners. Don't forget you are on a team. Don't ask close-ended questions. Don't forget to use the family, and don't be afraid to redirect.
Through the entire immersion experience, we were able to connect our project to and work towards the core competencies of CC, which are roles and responsibilities, communication, and teamwork. We look forward to answering your questions in further detail and cannot wait to chat with all of you.
All right, great job, everybody. Like I said before, I'm Michelle Cody, and I have with me Sarah Garber from Rosalind Franklin University. So Sarah, take it away.
Thank you, Michelle. Excellent presentation, and I love the telehealth list. I think maybe we could use this in future versions and include it in our orientation for IPD, possibly in the next version. Does anybody have any questions or thoughts? Yes, Dr. Sheldon.
Good afternoon, everyone. Thanks for the presentation. So this is to everyone who presented. What do you see as the future in your respective professions on the utility of telehealth? You know, we've been hearing over the past 2 years lessons learned from our various experiences with the pandemic. You know, much of care was possible because, you know, accelerated use of telehealth, which really hadn't gained a lot of traction across the country, so, you know, so to speak, in some pockets, but, you know, certainly got accelerated during that time frame. Do you re-envision your practice experience, you know, sort of based on what you learned, you know, through this past semester?
I think it does depend which particular specialty that you're in, but obviously for the physician's role, this is not going away anytime soon. We've seen telehealth only expand throughout the pandemic, especially, but also you've seen people move to areas of the country where they don't have access to the same amounts of care that you can get in cities and areas where they used to be living before remote work gave them the opportunity to move. Even outside of just medical care from a physician standpoint, two of my colleagues, Sarah and Tali, work in physical therapy and occupational therapy respectively. And I was really impressed with the way that they were able to incorporate their roles into our project with the COVID patient. Maybe they could take it away with that.
Yeah, so I'm Sarah. I'm the physical therapist that Meredith just mentioned. I find it hard just because of how hands-on physical therapy is to envision a world in which we do majority telehealth. I know it was a big thing during the pandemic, and this experience was nice because throughout my time at UNE, I didn't use telehealth with any of my clinical placements. So I think it was a useful skill in that sense. But it was interesting to try and use physical therapy over telehealth just by kind of thinking functionally. And I think Tali was on the same boat of like, functionally, what can we do in the moment that involves our role? And how do we describe that over the screen? Like we did breathing strategies and ways. She was really into dancing with her kids and how to get her back into that, which was kind of unique part of this experience.
Yes, I agree. I'm Tali. I'm the occupational therapy student. It was really interesting to be able to be on this interprofessional team and doing telehealth and just always remembering to like use the strengths that we have and use the resources that we do have. So relying on those like breathing exercises and things that we could just do in the moment with her and using things in her home as well was really helpful during this experience.
It sounds like there was a lot of creativity going on. How do we make use of what we have available and how to use our resources effectively? I think that's really excellent. Sounds like a really telling experience. Does anybody have any questions or thoughts to sum up this excellent presentation?
I can add something that I thought was unique about doing it like through the CEC was the fact that we did record all of our telehealth sessions, and a big chunk of what we did for our poster was reflection on kind of the recordings. Like we went back and watched through and we took the advice that we gave each other and what our paid actors had given us for advice. And that's kind of how we really came up with what our do's and don'ts lists were. And that's something that we wouldn't have gotten if we didn't do a recorded kind of telehealth simulation like this.
Can you remind me, the session I just jumped from, there was at least one of the students from another university, I think in Chicago. In this example, were there students from different universities participating? I mean, yeah. To me, that's also an incredibly unique kind of component to all of this. And again, this idea in the future that you could be collaborating with a practitioner, you know, literally anywhere, you know, in terms of doing what you're doing. So I don't know, it's not lost on me sort of the power of that. And to your point about expertise, you know, perhaps not being prevalent in certain pockets of the country and rural areas where you can tap into a content expert, you know, anywhere in the world, literally, to be part of a care team. So I don't know, again, it sounds, so remind me again where some of the other students are from.
I believe there was a student from Rosalind Franklin, which is just north of Chicago. We had Rosalind Franklin has allopathic medicine, whereas UNE has osteopathic, but everybody seems to work together really well, which is
on this series would like to introduce themselves, please feel free to do so, and then we'll start your video.
Rena, Gunnar, yeah, there you go, Miguel.
Yes, hey there. Hey everyone, my name is Miguel. I'm a first year physical therapy student, and we also have Gunnar on here as well.
Hey, how's it going? My name is Gunnar, first year PT student. Excited for this to get going.
All right, let's begin.
Hi, my name is Marima, and I'm an occupational therapy student who worked alongside Gunnar, a DPT student, Miguel, another DPT student, and we worked within the Westbrook Housing Authority and got the opportunity to perform a series of health and wellness seminars for the residents. Within each seminar, we presented on a specific theme and came with raffle prizes that were associated with that theme. For example, during the mindfulness seminar, we gave away oil diffusers and stress balls to complement the theme of mindfulness and reducing stress. The CC Mini Grant that was graciously awarded to our team has allowed us to incorporate prizes like these during every seminar, resulting in satisfied residents evidenced by the positive survey outcomes presented in the poster. As students, we learned how to communicate and empathize and welcome the older adult population through informative presentations, activities, and conversations. This allowed the physical therapy and occupational therapy students the chance to collaborate with one another for events to deliver professional and appropriate information. Given our background and unique knowledge we have learned so far in our program, we each brought unique ideas and perspectives and knowledge into the sessions. One of the biggest takeaways after giving the presentations was the impact that we made for those in attendance at the Westbrook Housing Authority. Despite the small turnouts, we were able to connect with the residents in a more personable way. We would like to thank Dr. Elizabeth Sire, Professor Elise Austinson, Reggie Robinette, Tom Muser, Professor Elizabeth Cramsey, Michelle Coe, Chris Hall for the endless amount of support and knowledge and guidance through this whole process.
Terrific. Thank you all. So, and the fact that you may have only reached a small number of people in these doesn't negate the power and meaning of this work, because you're helping us build this collaboration with Westbrook Housing. And I think I'll give the same question to all of you about this experience, those of you who ran it, Gunnar, Miguel. Did you have a personal connection or experience with one of the residents that really touched you as part of this?
I'm trying to think here. I don't remember having a specific conversation with a specific resident, but I do remember one of our meetings was it was very intimate. It was only about 7 or 8 residents, and we did get to talk about a lot of situations or a lot of topics that normally wouldn't be brought up. And we were talking a little bit about family and how to cope through this season, through the spring season. And I thought that time was really intimate in terms of just hearing what they had to say and some of their coping strategies. I think that was the biggest standout for me this semester.
Thank you.
I got to observe one session, and I was so impressed with how the students facilitated the group, how lively the group discussion was, how much everybody enjoyed being together.
Right. It was great.
How about for you, Miguel? Did you have any? I'm sorry, Gunnar.
Yes, I've done a couple of events at Westbrook Housing, and every time I went, I'd see some familiar faces, which was really nice. I got to build some connections with them. The presentation we did, there's maybe like 4 or 5 people there, so we had some time after, and we got to talk to some of the people there, and just face-to-face conversation was really nice with them. Got to see some of like their beliefs. I think the one we did was like on like goal setting and how that can kind of be tough for people that age. It gave me like a better perspective on just like dealing with that kind of population of people. So that was really nice.
From others in this room, questions or comments? Go ahead, Mike.
Yeah, good afternoon, everybody, and thanks for the presentation. So this question is coming because I just came from 2 presentations that were focused more on telehealth. So I know this was in person, and our ability to do that in part is because of the proximity of the campus to this facility. And I'm just kind of curious, your thoughts on, could this have worked in a telehealth modality? Or the other question I had is continuing to maintain connectivity in between the in-person visits to the campus. And any thoughts about either of those from your respective disciplines?
Well, Mike, I think that's a great point to bring up because, as we know, telehealth is well needed in Maine, and the majority of Maine patients and clients are going to be geriatric or elderly. So it seems like an ideal setting. However, I would say that part of the most joyous part of the experience was actually the in-person contact. And it really was where the rubber met the road, where I said, oh, this is why I'm in this health program. Otherwise, if I was on another tele meeting, I probably would be way less enthusiastic about the project itself. And I think it also wouldn't meet the needs of the residents necessarily because they are elderly. They're living, for the most part, singly in individual apartments. And community settings are really what keeps their mental and emotional health in the higher range. But then also that interprofessional collaboration in person where these, water cooler conversations take place, that's invaluable. And in the Zoom format, as we know, it's only one person can speak at a time and there's no mingling per se. So I agree, maybe what you brought up is using it perhaps as like a way of maintaining a maintenance visit with someone, sure. But I think the heart and soul, and Tom did a great job of kind of garnering like lots of excitement and involvement around it because it was in person and it was in, a community setting. So that's my 2 cents.
Thanks. That was a great response.
Anybody else have a comment on that question?
I have a comment on that. I was working with you, Tom, with the nutrition project we were doing at Westbrook. And yeah, I don't think that if we had to do anything with these residents on telehealth, I think it would have been a real struggle for all of us because just when we were doing all the pre-stuff and we had it on an iPad, it was really hard to navigate that technology with the residents at Westbrook Housing. So it's wonderful that we were able to do all these different things with them in person. Because I don't think personally it would have worked on telehealth.
Yeah, thanks, Amanda. I mean, I think this integration of in-person with digital contact and support is important. And I think it is the wave of the future for us. But how we do it and when, I think, still is an open question. And we've learned in some of these, and thanks, Amanda, for that comment, because in that project, we learned that the tech support needs of this population were very significant. And if we didn't plan ahead well enough for those, we were in trouble. So I think we're coming up on, I think, another time switch. Is that true, Elise, or do we have another 10 minutes to talk about this?
So you do have another 10 minutes to talk about it. I'm going to share my screen just real fast for the next minute in case anybody comes into our track and they're unsure of what we're going to be talking about. So go ahead and take like a 1-minute break or maybe think of some more questions. I think a few people had asked in the chat and be prepared to come back and answer them in about 1 minute.
Okay, we're going to get started. This presentation is on LGBTQ health, effective training for interprofessional emerging health professionals.
Study finds that cultural competencies in healthcare practice with LGBT patients is significantly lacking across health professions curricula. LGBT patients are vulnerable to informed care as well as to biases and discrimination that, as a consequence, may result in healthcare avoidance and or poor outcomes. Further, lack of knowledge regarding LGBT health contributes to practitioner discomfort and low confidence when addressing LGBTQ needs. The goals of this event was to raise awareness of distinctive features of LGBT health needs and increase knowledge surrounding the health needs of our patients.
The event was hosted on Zoom and included an educational part and a discussion part with breakout rooms. 40 student leaders from all professions were asked to serve in the breakout rooms as facilitators to guide conversations. There was an attendance of 76 students and faculty from different health profession programs at the event that were split into 10 breakout rooms. Prior to the start of the event, participants were asked to complete an 18-question survey known as the LGBT DOCS, which stands for Development of Clinical Skills Scale. This is a validated tool for determining changes in self-perceptions of attitudes, clinical preparedness, and knowledge of LGBTQ+ health. After the educational session, students were once again asked to complete the survey.
An unpaired t-test was done on the responses of the overall LGBT DOCS score, as well as the subcategories in clinical preparedness, knowledge, and attitudes. As seen in the graphs, the overall knowledge and preparedness sections had significant increases in the scores. However, the attitude section did not. After the event, the interprofessional student group members discussed different approaches on including LGBTQ+ education in their professions. They discussed incorporating LGBTQ+ care into simulation patient experiences, providing appropriate education on gender-affirming practice, including mental health treatment in LGBTQ patients, and then including occupational therapy in incorporating aspects and activities that provide gender-affirming care.
Many health professionals lack adequate training to provide comprehensive care to the LGBTQ population. This study was done to further explore the attitudes of healthcare professional students after attending an educational event focusing on providing interprofessional care to these populations. Using this survey, it was found that after the event, there was an increase in overall survey scores as well as significant increases in both preparedness and knowledge categories. These results would indicate that events about LGBTQ care would benefit health profession students in preparing them for working with this patient population.
All right, excellent. Another wonderful presentation. Let's get some questions from our audience. Audience, what questions do you like to ask the presenting group? Yes. Mike Sheldon, go.
Hi, Colin, how are you?
I'm good, how are you?
Good, great presentation. So my question is, and I'm not familiar with the survey tool, do you get to the granularity about, you know, one thing, it's, oh my gosh, this is going to be something that I'm definitely going to incorporate, like the big learn, you know, the take home. Were there a couple of things that came out that people said, you know, I had no idea about, but this is great. I'm going to add this to my toolkit.
Hi, I'm Ostea. I'm a first-year comms student. So I think that the event, people had to register for it. So I think it kind of goes both ways. So I think everybody who registered for the event and did go are people who are actively trying to learn about this topic and learn more. But I did hear from several students after, between several professions, that they did learn stuff that they hadn't heard about before. Does that answer your question?
If I could say something, I was one of the student leaders in the breakout group. And one thing that I heard and one thing we discussed in the follow-up was simple things that people could carry through were respecting people's pronouns and then even before that, kind of encouraging their practices or where they work to start including that on intake paperwork in a way that wouldn't signal anybody out and not have like preferred pronoun, but just be like, what's your pronoun? What's your, gender? Maybe multiple choices, maybe just blank so you can write it in, and having your legal name and then your desired name, something like that, so that it would take some of the awkwardness out of having people being like, well, I think they might be something, but and they have it across the board. So that was a big takeaway, I think, for people.
Yeah, I would agree with that. I think there was a big focus, I'm Austin, by the way, on passive ways to make sure that you are being as inclusive as possible, because a lot of times those are the things that can make a difference in those first few minutes. If somebody comes into your office, especially as a new patient, how can you create a setting that is not overt or over the top, but that it makes somebody feel comfortable coming in no matter what their background is. And so there was a lot of discussion about just simple things such as intake forms or just reading materials, ways that you set up the room to make people feel more comfortable, what kind of restroom access you have. Those are little things that you can do that can go a long way in setting the tone to make the LGBTQ plus populations coming in feel comfortable and willing to hopefully not already kind of have like their guard up before they even get into the room with you. So that was one of the big takeaways for me, at least, was trying to be more cognizant of trying to find those areas where you can just make those little things happen to make a difference.
Thank you.
I'm Sarah, and I was another student facilitator. And a takeaway from our breakout rooms was understanding that patients may have had past traumas or negative experiences that would make them hesitant to engage in healthcare. And so addressing that and making it a safe environment psychologically and physically, but also recognizing that somebody's walking through the door and they may have had a really negative opinion of healthcare workers in the past. And so that might be present in the care.
Hi, I'm Evelyn, PA student, one of the students on the team. The takeout in the breakout room was like, if we have, as a provider, we are well trained and know exactly how we're going to approach the patient clinically, then that discomfort will lessen and the patient will not see it through us taking care of it. It will feel that comfort, and the patient also will feel like, okay, I think I'm accepted here, and the provider really knows what she's doing or is doing.
Hi, and I'm Emmy. I was another facilitator in the breakout rooms and a part of this project as well. And something that really stuck out to my group during the discussions were just, like Austin was saying, how little things go a really long way. And how we can work together as providers, as healthcare professionals, to educate each other and ourselves, and just really be intentional and put in effort to make sure that everybody that we are seeing is getting the best care that we can provide.
I think all of those are some really strong takeaways. And were really important for everyone to hear and understand, especially because this is such an important topic to truly understand and have the knowledge around, especially as future healthcare providers. So thank you all for sharing that. We're going to move on to we're going to wrap up this one and move on to our last presentation. But before we do that, I'm going to drop into the chat a link for our attendance. So if you could fill that out before you leave today, that would be awesome. And now I'm going to share my screen to move on to the last presentation of the session. And this presentation is on peer health education.
Hi, I'm Hannah Hutchins, and I'm a health, wellness, and occupational studies major.
I'm Michaela Svensson, and I'm also a health, wellness, and occupational studies major.
And my name is Madison Willis, and I'm a medical biology major. So for our project today, we participated in the Peer Health Educator program. This program is designed to promote healthy choices and lifestyles through educating the community on campus with a variety of different topics. Because we are students, we are readily available in providing a more comfortable and laid-back environment for our peers to express their concerns and feelings regarding health. Peer health educators can provide non-judgmental support, act as a resource, role model, and referral agent. Some areas of focus include stress and time management, nutrition, fitness, sleep management, and many more scopes of health.
As for the process of Peer Health Educator, we participated in a 12-hour foundation training, and it is broken up into 8 modules, which we went through, and they include some areas such as understanding change and the roles of peer educators, as well as being an effective listener, and how to be a responder. Some trainings that we went through as well were bystander interventions, how to assess interpersonal applications of identity, programming strategies, as well as group development. And students who are certified in this training have been trained in the core skills that will make them a better leader, role model, activist, and team member.
For our assessment, we collected data from UNE undergraduate students. So we sent out a survey just to any undergraduate, no matter what their major is or age or anything. And the survey focused on the health and wellness and how it correlates to different events that are put on through the UNE campus. We sent out questions such as what students were most interested in gaining knowledge in, and that came out to be that students were most interested in gaining knowledge on nutrition and stress management. We also asked what their biggest limitation was when it came to attending these events, and they said that they did not have enough time within their schedules to go to these events. Another thing that we asked was what wellness issue they thought needed to be addressed more throughout the campus. And the most common answer that we found was that mental health needed to be addressed more, and there needed to be more resources provided to students at all times of the day and week for students to be able to address their mental health concerns.
So when discussing applications for future health profession, I am a medical biology major and future public health professional. Peer health education is a really important stepping stone to the public health career in particular, because both promote health education. In public health specifically, I would like to work in the scope of addiction crisis. And within this training, we did learn risk management within addiction and other habits as well.
So in the field of occupational therapy, which Hannah and I as future occupational therapists will be using peer health education in a large portion of our work with future clients, being able to provide resources as well as being able and comfortable to respond properly to people's intense emotions and feelings during these times in our life is an important factor that we will be using in our futures.
Wonderful. Thank you all for another excellent presentation. So again, I'm going to just turn it over to the audience and presenters. If you don't mind showing your videos, that would be wonderful. Audience members, same for you all. What questions came up as you were learning about the Peer Health Educator program? What questions do you have for these presenters? Yes.
Go ahead.
I just had a question. How do you suggest like the school and faculty adjust schedules to incorporate these concerns that undergraduate students had with incorporating wellness?
I think a large portion of our project that we did was mostly about advocacy as well as education. So I think professors being aware of these aspects that students are concerned about would probably play a big role in being able to incorporate these into students' daily lives and being able to touch on these areas of wellness that students are so dedicated and feel as though they are so important to them.
And to add on to that, I know that in orientation and first year experience and all those, you learn a lot about the areas of health and wellness, and specifically for Michaela and I's major, it's health and wellness. And we do learn a lot about that, but I don't think the other majors have as much opportunity to really learn about it, especially like other science majors, such as obviously we have a big like marine and environmental science, and they don't really see that aspect of health and wellness. So even just in our first year experience classes, we learned so much. So maybe giving students the opportunity just to like get to know about that and learn more about it, just not within first year and as we move up in like school.
Oh, I am the outlier. I'm the med bio major, and I didn't have to take a first year experience class. So for my major, a lot of people, I feel like it's the health and wellness is overlooked. It's just like pushing for classes and stuff. So I think we talked about this during our training, like maybe the integration of something like a first year experience class for everyone, just so the importance of health and wellness for every major is emphasized. So just like Michaela said, just advocacy and pushing for more focus on that is really important.
Thank you.
Great question, and thank you all for elaborating there. Other questions or thoughts or comments from our audience here for this group?
I have a question. I know how you said that only certain majors have the first year experience course. If it's not able to be put into all of the curriculums of the different programs, do you think that it would be beneficial for during orientation or when students are first becoming acclimated to uni as first years or as transfer students that a session on health and wellness be built into that orientation time period? And if that would address some of the needs that students who don't get that first year experience may get?
Yeah, I think that's a really important aspect. I know they do, Erin Neptune actually does do a whole section during orientation on health and wellness. She does a waves of wellness activity that all the students fill out all of their aspects of health and what level they're at, how they're feeling. And she takes those and kind of evaluates them, sees where students are at. And I think if we were able to do more of a follow-up as students go through college to kind of continue to see where they're at, where they might need support in different areas, that would be a great change and kind of an integration that we could have. And it doesn't need to necessarily be into a class, but just having that as an option and making sure that that's more advertised, that students know that that's available for them.
When we were looking at the survey results as well, a lot of people found like we stated, mental health was such a huge issue and the counseling services at UNE. So putting more emphasis on those, even just as a first year, second year, and as like obviously school gets more stressful as you are going up and like applying to grad schools and stuff. So you could have like the go in and out mental health issues and having that support and like knowing where to find it, I think also was one of the bigger issues, people not really knowing who they can go to, say they don't need to go to like an actual counseling service. But Erin Neptune, who we did our peer health education program with, she like is really helpful with that, and not a lot of people know her name. So I think even just getting her name out into the community would help a lot.
Thank you guys for answering that question and all of your questions. I think that was really helpful, and I definitely agree. I did the peer health education course in my undergrad, like you guys did, and I'm happy to see it. When I did it was just HOA students, so I'm really happy to see that it's starting to branch out more and more students have access to it, because we all will be healthcare professionals as well as like individuals, and having those critical active listening skills is really important in all professions. So I'm really happy to see that it's expanding. But that brings us to the end of our poster session. Thank you all for joining and presenting, and for our faculty mentors who joined and participated, as well as people who were just viewing. If you fill out our attendance, that would be lovely. I can drop it again in the chat, but that concludes our session. Is there anything you want to add, Colin?
No, that was wonderful, Megan. Thank you all for being here. Definitely fill the attendance survey. That data is really helpful to us. We really appreciate it. And thank you to all of our amazing presenters for all your inspiring work this year. We are really proud of you all.